So it's really nice to meet you. Public health careers. That seemed like really interesting. So could you give us like a little more insight on what you meant by like, the public health careers?
Yeah, so public health is a field that's very focused on trying to ensure that our populations, our communities, our provinces, our country is ultimately comprised of people who are healthy and well. And so the focus of public health, I like to say, is really on health. Most people will, go to a clinic, see a doctor, see a nurse practitioner, end up in hospital when their health has been compromised. But if we think about the real system that protects health, promotes health, gives people an opportunity to be healthy, that really is our day-to-day lives, our society. It's the choices we make in terms of, how we spend our time, what we eat, whether we exercise, whether we are within social groups or family groups that leave us feeling safe and connected. So the real health system is actually our society at large and the choices that we make, both to make it easy for people to make healthy and good choices in their day-to-day life, as well as the support that people get, particularly if they face certain barriers or challenges or disenfranchisement. And that essentially is the focus of public health and what makes public health such an exciting field for people to pursue a career in.
Yeah, that's really interesting. I had a question. So like, like the emergency in like hospitals, how there's like a problem right now with like the emergencies filling up with lots and lots of people. Do you think that's maybe because a lot of people are not going to doctors on a regular basis, so their health problems evolve to a more severe level?
That certainly is part of it in terms of access to primary care and to family medicine. And we do know that it is very difficult to find family doctors right now, and the primary care system has been having a lot of challenges. But it is also linked to public health as well, right? Because the reality is that if we don't put in place policies that allow people to stay healthy, if we don't have programs that support people, outside of hospitals to make sure that they get help. For example, if they have issues with mental health and well-being, if they have issues with, substance use, alcohol use, addictions, if they aren't able to access fresh food or fresh vegetables, those are all things that can actually precipitate or result in people having, things like heart attacks, things like strokes, in the physical side, also things like overdoses, or mental health challenges or injuries, as well on the non-communicable, non-infectious side of things. And so that will mean that if you have people who are in their day-to-day life not able to have appropriate health support and also live and make healthy choices, and they don't have access to a family doctor or a primary care team to actually address those issues early on, then they do end up becoming more severe and ending up within hospitals and the emergency and acute care system. So the answer is to really resource and support work in public health as well as the work of family medicine and primary care to make sure that we can prevent diseases and ensure that people are healthy as much as possible, and that if they do start to have questions about their health, they're able to see a family doctor or primary care team early before it actually gets to the point where they need to start going to the emergency room or the hospital.
Yeah, that's really interesting. So, I also had another question. What do you think like the healthcare will look like moving forward, like in the future with all this like artificial intelligence and all this like technology that's going on? How do you think this will like impact like the public health industry?
Yeah, I think for public health specifically, because the focus is on communities and jurisdictions like provinces, countries, AI has a lot of opportunity to really pull together data and insights from many different places that historically we haven't been able to look at. And that might actually allow us to target policies and programs more effectively to support populations to be healthy. So we can more easily identify, for example, populations that are facing inequities and the nature of those inequities, and then we might have new metrics that we can track to make sure that they are being supported through various programs. A good example, perhaps things like diabetes. We know that in many regions in Ontario, diabetes is growing. It's a growing issue, but we also know that it is one that impacts certain cultural communities, certain socioeconomic groups, and it's all related to diet, physical activity, access to care, genetic and biologic composition all put together. So if we're able to have better data around who's getting diabetes, where they might be getting diabetes, where we can actually focus our efforts, and that could be supported through aggregating all kinds of data sets from hospitals, from the community, et cetera. That will help to develop and target efforts. And then for the healthcare system, because I think of society as the health system, right? It's how we keep people healthy, but the healthcare system where people need to access it once their health has been compromised, I think we're going to see many changes as well. We really need to have primary care working in teams, basically where you do have family doctors and people still have access to a family doctor, but you also have access to other health professionals like dietitians, physiotherapists, nurse practitioners, pharmacists, all on the same team, so that you're eliminating duplication and confusion between providers. You're all working off of the same records. You're all working off of the same test results. And it isn't this fragmented kind of system that we have right now. And the reality is that AI can also help with that in terms of pulling together, records, pulling together lab results and tests, and also helping to formulate plans and ideas. I think in the future, with AI, you may actually see physicians become a lot more like airline pilots, where the work gets done automatically or gets analyzed and developed automatically based on the test results and some questions the patient answers, and then it becomes someone with a human touch to say, okay, these might be the diseases to look at, based on the algorithm. These might be the things we might want to consider. Can we double check and chat with the person, just make sure it makes sense, or if there's something that we might be missing or that the pattern didn't necessarily identify or pick up. So I think a lot of technology, I think the way we need to work needs to transform, and to the extent that we can use it as well for public health to make sure that we are more effectively enacting healthy policy and programs. That's kind of how I see AI and other solutions supporting the healthcare and public health systems in the future.
Okay, all right, thank you. I also had another question. So, do you see like any challenges or trends in medicine that you believe need like more attention or like more innovation overall?
There's a lot. I would say the number one thing is around misinformation and disinformation. I think there's a lot of myths and a lot of incorrect information out there around medical knowledge as well as interventions such as vaccination, and that is really not just threatening to cause problems with health in the future, but it's also threatening some of the successes and the gains that we've had. A really good example is around vaccination, right? We know that the measles, mumps, rubella vaccine is safe. We know that two doses gives you 99% protection against measles. We know that measles is not necessarily a trivial disease. For some people, measles can result in encephalitis, which is inflammation of the brain tissue that can lead to permanent brain damage. We know that measles can cause severe bacterial infectious shock known as sepsis. We know that it can cause mortality, especially in people who are immunocompromised. And yet we still have all this misinformation out there around the measles vaccine, when the reality is that it is safe, it's effective, and the measles vaccine successfully allowed us to eliminate measles within the North and South American continents back in 2016. So, which meant that there was no measles circulating in our populations in North and South America. Obviously, the situation right now is very different, and while the World Health Organization hasn't removed our elimination status as a continent yet, we are seeing a lot of transmission of measles because of low vaccination rates with the MMR vaccine. And a lot of that is related to misinformation and disinformation, which I think not just threatens health and well-being of our communities as a whole, but it also threatens our societal fabric as a whole. I think we don't need to look very much further than situations in other countries with leaders that are willing to say things that are not true, and then use them for political gain. And so I think I will leave it at that before I sort of go down a bit of a rabbit hole.
Yeah, that's very interesting. I also had another question. So I know you did a lot of work through the COVID-19 pandemic. Uh, I would like to ask for you guys to share some maybe the most important lessons you learned from that pandemic and how you could possibly apply those lessons to any future pandemics that might take place.
Yeah, I'm really glad you asked because I've actually written a memoir. I've drafted a memoir which I'm hoping to get published, which actually looks at lessons for leadership and resilience in crisis that we learned from the pandemic. Because we know that there's going to be future crises. We're living through some right now here in Canada. Different challenges that are going to arise, and it's important for us to think about and look at what were the things that got us through. And so I would say the number one thing that I learned from the pandemic, and especially as a leader, is that you really, and I already had this philosophy before I started as a leader, but I truly believe it even more now, which is most people that you work with, most human beings are actually, they're actually trying to do their best, and they're trying to do good by the situation and the circumstance that they find themselves in. And so if you lead with that in mind, if you lead with from a place of trust, from a place of having faith and believing in your team and what they can accomplish together, um, that's the most effective way to get through, especially through an emergency crisis where tempers are short, where pressure is high. You need to trust your team, and you need to make sure that you have your team's back, because if you have their back, they will have your back. And just making sure that at the outset you lead from a place of trust, from understanding, from knowing that they're trying to do their best, and really helping to foster and nurture that. And where things go wrong, as they invariably do in an emergency, focusing on what went wrong and how do we fix it, rather than who screwed up, is the most important way to approach that. So I think that's the first lesson I learned, and I saw that in spades. The second lesson is that when push comes to shove, most people are willing to look out for others as well. So this is not related to the teams, but to the broader community. I think the collective action that we saw throughout the pandemic, there are a lot of people who had some very strong opinions and extreme opinions about whether we were doing too much or too little to address COVID-19. But I found that the vast majority of people were quite reasonable, and they understood, for example, that we needed to find out more information, that the information was always changing, that we always needed to make sure that we changed with it too in the event that we got new evidence, for example, around masking, or in the face of more infectious variants that required us to take more significant measures. So I think it was reassuring to know that most people are actually willing to look out for their other fellow people, the other folks in their lives. They were willing to stay home to make sure that the more vulnerable people in our society were protected. They were willing to look out for neighbors, willing to look out for first responders. And so I think it's a testament to the human spirit, and if anything, that's something that we want to capture. A lot of people are worried about, in the future maybe people won't do that, but I don't think so. I think the people who were confrontational and standoffish really represented a minority. I think the vast majority of people were really trying to look out for each other and make sure that we got through it together. And then the last thing that I really learned throughout the pandemic as well was the importance of being clear, being transparent, being open. A lot of the messages a lot of the things that we delivered, a lot of the things that were decided were not popular, and they were also very foreign. People didn't understand what was happening. But I found that as long as you were able to explain in a clear fashion and explain with evidence and why you were actually pursuing a specific route, you could convince most reasonable people that this was the right course of action. And so for leaders who are leading through crisis or leading in general, I always say that there's nothing, honesty is the best policy. And nothing is more effective than actually being very clear about what we know, what we don't know, and what we're doing to continue to keep people updated and how we're getting them the information they need. That's really what it comes down to at the end of the day, especially in the midst of uncertainty and unknown, and an environment where there's so much misinformation and disinformation floating around there. As long as you tell people exactly what it is that you know, what it is that you don't know, and then the ongoing process by which you're trying to get information and clarity and how you're going to keep them updated, that's the most effective way to ensure that people trust you and understand what is happening.
Yeah, that's very insightful. Also had another question. So like since you've already like led during the pandemic, you earned a bunch of incredible awards and you made such a huge impact on public health. I really want to ask, like, what do you think is next for you? What do you think is the next big step, and where do you see yourself taking your work and influence from here?
Well, I think the most important thing that came out of the pandemic is that I saw firsthand, my own perspectives validated. I've always trusted people easily. I've always cared deeply about causes. I've always believed that we can do, difficult things together. And I think that really ties into a story that came from the pandemic that we haven't really had the chance to unpack. The reality is that I was supported. The work that I've done was not on my own strength, but thanks to a really amazing team, friends and family that supported me in the background, a community, leaders, local, provincial, federal, that stepped up. And even though we didn't always agree, we did have the opportunity to work together. We had internal partners within local public health, as well as external partners, as well as public health partners, not just in Canada, but across Ontario. Well, not just in the GTA, but across Ontario, across Canada, across the globe, that we had the chance to work with. So it was many hands. And I think the story of how that happened and the positivity and optimism that comes from that is, you're not alone, and you are working together, and people are good, and they are willing to step up together. We need a lot of that in our society today. I feel, in recent times we've become more divided. There's a lot more conflict. There's a lot more turmoil. And we need to sort of remember that the only way we made it through COVID was because we came together and because people were willing to put aside differences and divisions and try to figure out what was best for us collectively. And so to the extent that I can hopefully share that through publishing my memoir, share that in speaking with different audiences, bringing a bit of that story of positivity and optimism and the strength of collaboration to different forums. If I have the opportunity to bring it either in my role as a public health physician or if, more independently to non-health audiences to understand how we were able to get through what was the longest emergency response in the history of Canada, to broader audiences. That message of positivity, optimism, and collective action is hopefully something that I can bring to a world that is really struggling through many different crises and turmoil right now.
Yeah, that's really insightful. Yeah, thank you. I had another question. So, like the next pandemic or like the major crisis that may happen in the world, now, like scientists have predicted that that may happen in the next coming years based on what we've seen from COVID-19. So, how do you hope like humanity will kind of respond to like that pandemic that may occur based on what we've learned and gained from COVID-19?
Well, I think it would really depend on what comes out, right? I think COVID was actually quite interesting virus, and I know that the questions of its origins and the questions of how it all came to is still something that's being actively studied. In my view, COVID was very well suited to human interactions in a way that many other respiratory viruses weren't, right? We knew that some people would have very minimal symptoms and be able to pass it on, while other people might have very severe symptoms but not pass it on. We also knew there were different situations where people might pass it on in a super spreading event. And it was a really just specific situations and contexts where most people were just passing it on one to another, but then you would have these super spreading events, sometimes with people with minimal symptoms. So it was able to very covertly move throughout our populations as a result of it, the way it had adapted in that manner to spread through populations. I would think that if there is another pandemic in the future, it would hopefully be something that's maybe not as well adapted to human interactions in terms of the lighter, less symptomatic spread. But I would hope that people would still be able to look out for each other. I think we're seeing it right now. I mean, even in current crises, even in the present crisis that we're facing here in Canada, just around specific economic relations with other countries, I think we've actually seen a lot of people come together and be willing to look out for each other and collaborate. And I think that is the fundamental thing. If we lose the ability to look out for each other, and to empathize, that's when I'd start to worry. But I think I've seen through crisis and crisis that people are willing to help out and take their time and energy to make sure that everyone gets through together.
Yeah, that's very impactful. I also seen that you also very like running and you've ran many marathons. Could you just walk me through if that has shaped the way you approach your life and your work?
Absolutely. I mean, running is a big part of my life. I think you also have to be quite disciplined to run and be like, yeah, every morning you get up, you're going to go for a run. But I think running is great because, especially when you run marathons, you're always focusing on making sure that you're just keeping going, right? And at some points, especially when it gets quite difficult, especially when you're really pushing yourself, you know that you still need to continue and you need to keep going on. I think that's something that helps me in terms of navigating crisis. Just the idea that you're putting one foot in front of the other. You've got to make it through to the other side. It's really like that old Winston Churchill quote: "If you're going through hell, we'll keep going." Right? And so I think that's helped. More broadly, running has really helped shape my worldview and perspective in terms of stories and creativity. I find it a great opportunity to clear my mind, but also think in a different way around problems that I have been maybe working on or navigating, and that helps me bring clarity to solutions, but also sometimes a new perspective and a new kind of theme that I'm just like, oh, this is some part of the story that I hadn't seen before. And as I try to look at writing and speaking more broadly around positivity and optimism, having the opportunity to be in my head and to think through that stuff and gain clarity around some of the lessons that we can employ has also been really great. I think I have maybe time for one more question, and I probably have to head off. But
Yeah, thank you. I was also wondering, so like, what is like the leadership in like public health? Like, I know you were talking about like leadership in like public health careers. So what exactly is that like today in like the modern 21st century?
yeah, so public health is, I mean, there's all kinds of leaders everywhere within the public health agencies, but traditionally, public health positions in Ontario have been the medical officers or the chief medical officers for different jurisdictions, whether it be a community or for the province of Ontario or for Canada as a country. And so I think what is the most important thing around public health leadership is less about the title and the authority that comes with. I mean, a lot of the health orders that were issued during the pandemic, a lot of the response things that were taken in the pandemic, those were unprecedented, and those are not things that we would traditionally do. But rather, I think the bigger thing is understanding in leadership that it can take many different forms, right? And so there are times where public health leaders, whether it's health officers or part of the senior leadership team of a public health agency, whether they come from nursing or from dietitians or dentistry, whoever the case, whatever the case is, the senior leadership teams of public health have a very important role in highlighting health issues within the community, in advocating for people who face barriers to good health, in advocating for addressing things like disparities and inequities, and also in speaking to effective evidence-based programs that are suitable for context that will help people protect, promote, and optimize their health. And so I think there's a lot of things that are happening in our day and age that have the potential to imperil the health of our populations. And so public health leaders, whether it's a traditional medical officer, chief medical officer role, or someone who is a senior leader within a public health agency and society, there's an important role for all leaders within the public health sector to be speaking up around the importance of healthy public policy and programming.
Yeah, thank you so much for joining us. We really appreciate all your insightful like comments and everything you told us. It really means a lot to us. Yeah, thank you so much.
And all the best in your pursuits and your career.